as part of efforts to improve that in the country, the Nurses and Midwifery Council has introduced specialization courses in the nursing and midwifery profession as they celebrate 50 years of existence. The programs are intended to reflect an added value to nurses or midwives seeking to diversify their careers in their chosen specialized fields and also to benefit patients who require their services. Also know more as Gifty Abuajimenta, Public Relations Officer for the Ghana College of Nurses and Midwives, and Barbara Edu, a palliative nurse, join me in studio. Ladies, good afternoon. Great to have you. Tell us a bit more. Let me start with Gifty. Gifty is, Gifty. Yeah. Tell us a bit more about the specialization and the need to specialize in the first place.
Okay, so thank you very much. Ghana College of Nurses and Midwives was established by law, mandated to train specialists in nurses and midwives to augment the need in the healthcare system. This is so because you go there and then most of the nurses and midwives are general nurses. So without the doctors around, you have to wait. So now we need to have specialist nurses. So now Ghana College of Nurses and Midwives was introduced to take care of that. So we train nurses in that field. We have specialists in nephrology, oncology, palliative care, about 13 areas that we train them. Okay. That we train them for that. There's the need, because when you go to the health facility and there's somebody that has to do A, B, or C for you, and there's no doctor around, the next point of call should be the nurse. And we can't afford to have nurses that just have general knowledge of what they are doing. They have to specialize and understand what the patient is even going through. What you are going through. So that was the need for.
Interesting. So you are a palliative nurse, Barbara.
Yes.
And before this, were there facilities available in Ghana for nurses, public facilities, I mean, for nurses to learn and specialize in any of these fields?
No.
So how did you specialize to become a palliative nurse?
Okay. I had to go to the training at the Ghana College of Nurses and Midwives, as she just said. So you go in with a degree, you know, to start. But this time around, you can have a diploma and then do a 1-year associate member.
Okay.
But if you want to do the 3-year member, you should have a degree to do that.
Okay.
So that's how I entered into.
Okay. So
to add to that, you have to be a practicing nurse with a valid PIN before you can do the membership program. Okay. If you want to continue to be called a consultant, then you come back and do the fellowship program. But a fresh nurse cannot come. You have to be a practicing nurse. That is one of the qualifications. You have to be a practicing nurse with a valid PIN before you can come to Ghana College of Nurses and Midwives.
So what advice do we have for maybe nurses out there watching us who are asking, why should I upgrade or enhance my credentials?
Okay, let me come in. So specialization is, you know, it's about specifics, isn't it? So we have all these diverse kinds of programs that we have, as she's earlier mentioned. We have the palliative care, the addiction, and all of that. So if you come in, you specialize. It's just like division of labor. You have to learn on that job and then do just that. So that makes it easier, right? You have specialized in that area. For example, I have specialized in palliative, so it's easy for me to take care of people who need palliative care than I would have done in the general nursing.
Okay, yeah. Okay. So how does the public benefit from your learning these specializations?
So you meet a nurse on the ward who is a specialist, and it's an emergency. There's something that has to be done for you. You don't wait for the doctor. Now you have somebody, the next point of call, to attend to you, who has knowledge. Because mind you, our mode of training is not the normal general nursing. We do the supportive clinical teaching and supervision. What I mean by that is when you are going, we're sending our residents to the clinical sites. We don't just leave them there to be taught by the general nurses on the ward. The person is going with a faculty who is teaching you in the classroom. You go there with a clinical coordinator who has been taught by us to follow the curriculum and how we want you to be taught. You go with a clinical educator who is also to follow a certain trend. Then the preceptor, the person that accepts you on the ward, is also trained by the college. So you don't just go there and they say business as usual. You have to follow it like that. So when you go to the ward or a patient comes to the ward, you are sure that the nurse taking care of you knows what she's about. Knows what she's about to do. It makes me feel more confident. Know what you're about. Yes. I should say when I get to the hospital next, I'll ask for a specialist. Finally, tell us about the 50th anniversary celebrations. So NMC is 50 years, even though we are coming from the college. But NMC as a regulator has been in existence for a very long time and has been helping with streamlining things in nursing and midwifery. Because, of course, we have a lot of challenges and we need somebody to be in charge, to take the bull by the horn and do what is needful. So NMC is there. 50 years we are celebrating, and it is a year-long thing. Right. From January to December. So we are really into it and we are having fun. Nice, nice.
And our theme is projecting nursing and midwifery specialization. The theme for the celebration is projecting nursing and midwifery specialization, which we are doing now. Yeah. So we are celebrating even now. Yes. It's amazing. What other activities should we look out for? So this week we've had a lot of webinars for young nurses and nurse managers. Next week, Ghana College of Nurses and Midwives will be having its AGM, annual general meeting, and we are going to graduate and induct 243 residents that have finished our 13 courses that we do. So the over 100 that we did the pediatrics. That was sponsored by Sick Kids from Canada. Okay. We have Johnson & Johnson that are going to do it for mental health. We have Roche that does it for adult oncology. Then now we have World Child Cancer on board now, doing it for pediatric oncology. Okay. Because the children who have cancer also need that specialist to help. Right. So that is what is coming up this week and next week. Awesome. We can't wait to take part, to help and support in all of these activities. Thank you very much. Thank you for joining us, ladies. Thank you. You're still live on The Pulse with me, Daniel Dazel, speaking to Gifty Abuajimenta, Public Relations Officer for the Ghana College of Nurses and Midwives, and Barbara Edu, who is a palliative nurse. We spoke about specialization in the nursing profession.